Assalamu alaikum and good evening all of you. Before starting anything, I would like to share a famous spiritual quote which I always use to amplify my abilities. It goes like Imam Ali Raza quote from his father Imam Musa Qasim. He quote from his father Imam Jafar Sadiq. He quote from his father Imam Muhammad Baqir. He quote from his father Imam Zainul Abidin. He quote from his father Imam Hussain. He quote from his father Maula Ali. He quote from the Holy Prophet Muhammad sallallahu alaihi wasallam. And he said, what faith is? Faith is knowing from your heart, expressing it through your tongue, and performing it with your organs. So whatever you do in life, faith is the basic necessity for everything. So now, continuing with the arrhythmias. The word arrhythmia means irregular rhythm or no rhythm. So, arrhythmia is a disorder of the heart, the cardiovascular system, in which the rhythm of the cardiac performance is disturbed or is not present. There is a proper rhythm through which the cardiac performance occurs. First of all, a depolarization occurs through the cardiac myocytes, which develops or initiates the action potential, and it is conducted within the cardiac myocytes, through which the contraction, that is the systole, occurs, and followed by the repolarization, through which the diastole occurs. And this is the proper rhythm of the cardiac performance, which is not present or is disturbed in the condition which is known as arrhythmia. Now, the arrhythmia is characterized by abnormal automaticity, that is the automatic fibers and their responses becomes abnormal, that is the automatic fibers are responsible to generate their impulse, their self, that is the SA node, the AV node and the Purkinje His system. This automaticity is abnormal or deflects from the normal pathway. Furthermore, after the generation of impulse through the automatic fibers, that is abnormal generation of impulse, it is not conducted properly within the cardiac system. Now there are several factors for the abnormal automaticity and impaired conduction, which include the requirement of oxygen by the cardiac myocyte is not achieved successfully, that is ischemic heart disease. Furthermore, the electrolytes and pH disturbances of the body and the cardiac system also develops abnormality in the automaticity, and the conduction is also impaired as a result of electrolytic and pH disturbances. Furthermore, mechanical injury of the myocardial tissues also develops the abnormal automaticity and impaired conduction. And furthermore, there are some neurogenic factors that initiate the abnormal rhythms of the heart. And last but not the least, drug influences also develop or promote the abnormal automaticity and impaired conduction, which is also referred as drug-induced arrhythmia. Now, what are the mechanisms of the production or propagation of arrhythmias? There are three main mechanisms for the progression of arrhythmias. The first is the enhanced pacemaker activity. It is also referred as ectopic pacemaker activity. That is, the pacemaker activity is increased by itself due to any factor which we have discussed earlier. So, the pacemaker activity is increased and develops the beats before an initial beat was developed and perceived and propagated completely. That is the development of another beat before the complete progression of the existing beat. which is due to the enhanced activity or abnormal activity of the pacemaker. The second factor is the abnormality in the after depolarization phase of an impulse generation, which is further classified into early after depolarization and delayed after depolarization. These both are abnormalities in the after depolarization phase of the impulse generation. Now consider this figure in which the early depolarization and delayed after depolarization pathways are elucidated. Consider this first, that is the early after depolarization. This is a typical generation of an impulse which we have discussed earlier. This is considered as the phase 0 in which the depolarization occurred, and further the achievement of the maximum membrane potential, which is the phase 1, and after that the plateau phase, that is phase 2, following the repolarization, and further the third phase, that is the repolarization. So starting from here to here is the depolarization, in which the depolarization is achieved and is maintained within the second phase. So the abnormality appears at the start of the third phase, which is the repolarization phase. The repolarization phase is to be achieved through the fall of the transmembrane potential by returning it to the resting membrane potential. This is the regular or the normal pathway which was to be achieved by the impulse. But here in the case early after depolarization, there is the generation of another impulse before the complete repolarization and the effective refractory period. That is, from here is the generation of another beat bypassing the complete repolarization and effective refractory period, after which the second beat was to be initiated. So the second beat is initiated early after depolarization, bypassing the phase 3 and phase 4, that are repolarization and after repolarization, which is also known as effective refractory period. The second is the delayed after depolarization abnormality, in which the phase 0 to phase 1 to phase 2 is maintained normally, and the phase 3 is also maintained normally. But after the progression of the phase 3, the phase 4 was to be initiated, thereby ensuring the effective refractory period. But due to the abnormality, the phase 4 is bypassed and another beat is generated before the phase 4, so it is considered as delayed after depolarization. This beat was generated early after the depolarization, while in this case another beat is generated delayed after the depolarization. So in the early depolarization, the phase 3 and phase 4 are bypassed, while in the delayed after depolarization, the phase 4 is bypassed and the effective refractory period is bypassed, and another beat is generated without a minimum time interval that is needed between the two generated impulse for maintaining a regular and normal impulse and conduction system. So this was all about the after depolarization abnormality. The third mechanism is through the re-entry mechanisms. This is a typical pathway for the impulse generation and conduction within the cardiac myocyte. That is, starting with the pacemaker, that is the sinoatrial node, the impulse is generated, which is then transferred, or you can say conducted, to the atrioventricular node and furthermore to the Purkinje his system, and after progression and complete conductance and repolarization, it is then transferred back to the sinoatrial node, and after receiving it in the sinoatrial node, another beat or impulse is generated. But as a result of re-entry, there are abnormal beat and impulse generations within this pathway. That is, before the beat that is produced from the sinoatrial node reaches the whole pathway, another beat is generated from the sinoatrial node, which is also elucidated as the enhanced or ectopic pacemaker activity. That is, before the progression of a complete impulse generation and conduction, another beat is propagated or initiated. And furthermore, as a result of abnormalities, the beats are re-entered into the pacemaker without being conducted through the whole pathway. That is, the generated beat can return from the atrioventricular node without reaching to the Purkinje-His system, or furthermore, or just after receiving the beat at the Purkinje-His system, it can re-enter the beat or dispatch the beat to the sinoatrial node before conducting it into the Purkinje-His system normally. So a lot of re-entry systems can be elucidated due to abnormalities for which the factors have been discussed earlier. So there is irregular or abnormal conduction system of the heart, that is, the normal pathway is deflected, or re-entry mechanisms propagate the normal pathway, due to which simultaneous or spontaneous generations of beat occurs, which affect the rhythm of the heart and develop the condition which is known as arrhythmia. So this was all about the arrhythmias and the mechanisms responsible for the production and propagation of arrhythmias.